Metformin as a fertility enhancing tool. This is our topic for Fertility Tip Tuesday. Dr. Raquel, you get this question all the time. I see this question all the time on the Fertility Answers app. What really is metformin and how do we use it in the field of fertility?
Yes, so great question. So metformin is, okay, I'm going nerdy again. Metformin is a biguanide, meaning that in the world of pharmacology, biguanides inhibit new glucose from being formed, or gluconeogenesis. So the reason why they give it to women, it's either because they have type 2 diabetes or they have PCOS. So what metformin does is stops your body from producing excess glucose or new glucose so that your insulin can function properly, because when it doesn't function properly, it affects fertility by inhibiting ovulation and affecting implantation too.
Okay, so if you're insulin resistant, that could be the actual cause of not ovulating correctly.
And 1,000,000%.
And if you're not ovulating correctly, then you'll probably have irregular periods.
Exactly.
Okay.
Yeah.
So
that's why the first line therapy in PCOS is because they try to get to that first.
Got it. So you're really trying to solve for the insulin resistance first, but are they testing for insulin resistance, or are they making an assumption that you're insulin resistant?
So it's so funny you said that, because me and my friend did another talk about this too. But when it comes to PCOS, they assume. So if they see like, oh, you have a little hair on your face, or your voice is a little deeper, you're overweight, you probably have PCOS. Let's give you metformin. So a lot of times the doctors don't test for it, which is like bad. But
I hear that.
But oftentimes doctors will check like your hemoglobin A1C to kind of see like where you are, and then
simple blood. You don't have to do like fasting glucose thing, right? It's just
right. So some doctors will do both, to do the fasting glucose and get your glucose, normally will be different. But oftentimes if you're just going into a fertility clinic, they'll get your hemoglobin A1C just to see where you fall.
Okay, got it. So this is kind of interesting though, because I feel like a lot of patients coming to the app, we see their weight, we know that they're overweight. They're not really saying, hey, I'm insulin resistant, I'm on metformin. They're saying, hey, I have PCOS, I'm on metformin.
Yep.
That's my red flag that, hey, did they not get proper testing?
Yeah, and that's huge.
And they're not really, so also if you're just taking metformin and you're not doing anything with nutrition or your diet, is it really going to work?
Exactly. So what'll happen is, what I've heard from a lot of women is that when they take metformin but they don't change their diet, it makes them extremely nauseous, like very, very sick. And the really bad thing about that is that you're masking a symptom, because you don't need the metformin. It's that you have had so much sugar, or you kind of block this insulin pathway to the point that now your body is not responding the way it should. So now you need metformin. But if you change your diet, make small adjustments, you'll take away the need for metformin so that your body can function efficiently. So you want to make the diet change first.
Oh, how do we get that mission across? How do we get that message across? Because I feel like this is one of the biggest challenges that our users are facing. I mean, 60% of the reproductive age market is dealing with weight as a primary issue. They're dealing with obesity. And if they're just going into a primary care doctor or an OBGYN setting and they're being prescribed metformin as like a quick fix,
right?
Are we really setting them up even for a healthy pregnancy if they're trying to conceive? Because what are they going to do when they're pregnant? Aren't they at super high risk for gestational diabetes?
Exactly. And that's why I always say, like, the key to a healthy pregnancy is a healthy body now. You don't want to have to take metformin. It's not something that you want to have to take. If you have to, then okay, this is what we're going to do as the first line. But you have that power. Like, you have control to change it, And so that's what's big for me, is seeing, like, why do you need metformin? Why are you on metformin? And is there a way we can get the dosage down to the point that you don't need it at all?
Got it. Okay. So maybe in the beginning, it sort of jumpstarts people's adoption of healthy habits, because they're like, okay, well, I'm doing something, I'm helping, I'm taking the medicine that I need to take, but I also am making all these diet changes so that I don't move from insulin resistance into full-blown type 2 diabetes.
Yeah.
And what is the line? Dr. Raquel, what is the difference really between insulin resistance and type 2 diabetes?
So when you go to the doctor, what they'll do when they test your hemoglobin A1C, they look at certain markers, and the cutoff is going to be 7. So when you're at 7, doctors are like, okay, you're in that that range of going from being pre-diabetic to diabetic or showing signs of insulin resistance. But what I like to do is I don't even want you to be at 7 to make me say, let's change now. I like patients to fall between like 5 or 6, because to me, you're already getting closer to the numbers. So let's try to see where you are now, because what's that showing is that when you're eating sugar, your body has become so resistant to insulin that it's like the sugar's just been being thrown at a dead receptor. So it's not responding to it. So when you're getting to 7, you're already showing those signs of insulin resistance. So you want to get ahead of it way before you get to that 7.0.
So I'm just picturing what I feel like if I have too much sugar and and my body can't like process it fast enough. And I don't know why. I don't know if this is right or if I've heard this wrong, because if Dante eats some sugar, because it was just Easter candy time, Easter Bunny dropped a little bit of too much chocolate for him. And, and also he's been on like an ice cream kick with this whole quarantine thing. And so if has too much and maybe he feels a little bit off or almost like dizzy, then I have him reach for some protein. I don't even know if that's the right thing to do, but that's kind of what I tend to do too. Is there a biological reason that I'm doing that?
It is. You got so smart already. I mean, you're so lucky. So that's what they tell people to do to control those insulin spikes, because your body is going to release insulin when you have a meal. Okay. But what happens is you don't want it to get to the point that you're eating so much sugar that your body does not know what to do with this insulin. Right. So what protein and fiber does is that it helps your body to respond correctly. To insulin absorption. So it helps to slow it. So it's not this intense spike. It's just a small curve, and then it can drop back down. When we eat sugar, our body zoop, like it just goes all the way up.
Right.
So yeah, it helps kind of like stabilize.
Insulin resistant and your sugar spikes and you can't use the insulin. So what happens to it? I'm trying to visualize.
Yeah. So what happens is what's supposed to happen normally when you eat a meal. Of course, insulin is released in response to ingesting food. But what happens is after you ingest that food, it's supposed to go back down to be more regulated at a normal level. When you become insulin resistant, your body can no longer regulate itself. Okay. So that's why they say like your sugar is high, because it never utilizes. It just stays spiked.
They don't talk.
Exactly. No communication.
Okay. Right. They need a therapist. We need a therapist between like the sugar and the insulin resistance so they can get talking again.
Yeah.
Okay.
Yeah. It's no regulation.
When we think about that sugar rush, it's why we weren't able to use the insulin. So it hasn't done anything. And that's why like I'll get kind of brain foggy or maybe nauseous or like I can't focus or something, if I've had too much sugar. And can you explain also what low glycemic index really means? So like, when people are juicing, they're like, well, don't have too much sugar in your juice. And it's like, but it's an apple base with a bunch of greens. It's a low glycemic index. What the heck does that really even mean?
Right. So low glycemic index just means that these foods won't cause your insulin to spike. So these are going to be like nutrient dense foods. So a lot of times, like you said, it'll be like apples, melons. Now, strawberry is not a low glycemic food because it has such a high natural sugar content. Okay. It can cause your insulin to spike a bit. And people with insulin resistance, they don't have that mechanism to regulate their insulin.
Okay. Like if you want a fruit, have an apple, have a melon, like a
apple, melon. Yeah. Berries are really awesome. Now, strawberry, no, but like raspberries.
Okay. Yeah. If you're insulin resistant, should you be carb free?
That's a huge topic of debate because of the whole keto diet.
Right.
So a lot of people swear by the keto diet, which I've seen really good responses from it. But it's almost saying like having no fat. Like there's good fat and there's bad fat and there's good carbs and there's bad carbs.
Got it.
So
okay.
No carbs. It's almost like, okay, you want to have carbs because vegetables are also carbs, but you want to make sure that you're having like very good carbohydrates and not
Wonder Bread. No offense, Wonder Bread. Don't get mad at me.
I know. No offense. But yeah,
but not the Wonder Bread. Okay, got it. All right, that makes a lot of sense. And it is reminding ourselves that, one of my favorite things about talking to you is that we're constantly telling people, You don't have to say no to everything. You don't have to be perfect. You know, it's about balance, and it's about giving up shame and giving up, over control. So I think that when it comes to us and our relationship with food and our relationship to these healthy habits, it can go very dangerous very fast into bullying, shaming, body image issues. And that's not what we want at all. We want people to like honor their body so much that if you want to conceive, if you want to have a baby, that you treat yourself with the love and care that you would your newborn.
Exactly.
Right? We would never do anything. I didn't let my kid have any sugar for the first 2 years of his life. Not, sugar. Like of course there's sugars in food, but like I didn't let him have like a candy or sweet or anything for the first 2 years. And I was really, his first dessert was like, bitter chocolate. And he loved it.
Wow, that's so awesome.
Not so much anymore. The Easter Bunny just gave him a whole bunch of junk. So crack down on that Easter Bunny. Yeah, but I think this is such a compelling topic. I mean, if anything, I just want to motivate people to, metformin doesn't have to be forever. It is absolutely the indication, though, the opportunity that you can change your diet. You can make better choices. And like, I can think of no better time to connect in a telemedicine consult with you, Dr. Raquel, where you can actually do kind of a diet inventory and like look at how they're eating. You can check their micronutrient levels and let them know, here's what you're absorbing, here's what you're not. Let's clean it up and let's get you off metformin.
Absolutely. Absolutely.
Okay.
Yeah.
But it is something that's used in conjunction with Clomid or not with Clomid. Are they two separate things? So they usually go together.
They're two separate things because Clomid is used to help with ovulation. So because women with PCOS also struggle with ovulation issues, doctors will give Clomid. However, Clomid affects the cervical mucus. And this is also a very racy topic because Clomid does work. They do Clomid a lot for IUI. And for a lot of fertility treatment. So Clomid is very effective because it helps with ovulation and it helps women that are struggling with ovulation, with PCOS or not. It helps a lot with that. But it can also affect the consistency of your mucus to be sticky enough so that the egg and the sperm can meet. So you want to make sure that you're taking this, but you're also being very conscious of how it affects your body. So
I'm seeing the emoji.
I know.
Here's the thing, like our bodies, I mean, we're such miracles, right? I don't love, that word in sort of, too much of the public domain because, people might think that I'm getting overly religious on them. But we are such miracles, right? We're such complex creatures. And all of this is such a delicate balance that when people come to us and they're like, hey, I've been struggling for so many years. And they look at the world and they go, but everybody got pregnant so easily. When we think of the myriad of things that had to go right for the pregnancy to happen in the first place.
It's a miracle.
And if your body is not optimized to facilitate that miracle happening, that it is the opportunity to get wellness in order. It really is. And so when I think about that too, I want to clarify one point. So not everyone with PCOS is insulin resistant.
Exactly.
So not everybody needs metformin. And so the people who are taking metformin are usually insulin resistant. We're assuming that they got tested and we know that not everybody is.
Right.
But let's assume that they are. Do they then also need Clomid to facilitate ovulation, or does metformin usually do the trick in that particular case? So Clomid is really for people who are not insulin resistant, but also still are anovulatory.
Exactly. Perfect.
That's
perfect. And I just, I do want to make a disclaimer that metformin is a drug that is needed. It is first line because sometimes people really can't regulate their insulin, and having your glucose too high really can affect you.
Right.
So metformin is a first line drug and it is very effective. But I love what you're saying about metformin and Clomid. Clomid is treating your ovulation. Metformin is treating insulin resistance. So they're treating symptoms.
Yeah.
In naturopathic medicine, that is huge for us. We don't treat symptoms. We treat the cause.
Yeah.
So why are you suffering with insulin resistance? Why can't you ovulate if you're in your, in your reproductive age? So that's something that's really big. We don't treat based on symptoms. We treat based on cause.
Okay.
So although you might need these things, let's let you have them so that you can get through this cycle. But then let's take a step back after to see, like, how can we treat the cause of your PCOS or infertility?
Okay, last question, because now we're like over our time for Fertility Tip Tuesday.
Okay.
we give people a lot of juicy stuff. Is if they are pregnant with gestational diabetes, is metformin safe to take through the pregnancy?
Oh, that's a great question. So I'll have to double check to make sure, but I feel like metformin is one of those drugs that is safe.
Okay.
Don't quote me on that. I have to make sure I check.
All right, we'll double check and then we'll put the information in the comments and all the links and all that. Okay.
Yeah, but it is a first line drug. It's a first line drug for type 2 diabetes and PCOS.
Yeah. Okay, got it. Excellent. Well, that's Fertility Tip Tuesday. You know, consistent message is you have agency over your body. You have choice in what goes into your mouth. If you're already taking metformin, it's a great opportunity to connect with someone like Dr. Raquel. We also have some nutritionists in the Fertility Answers app. I can't wait to see you next week. Thank you so much. It's always a pleasure. I'm learning so much.
Me too. I love it. I love it.
Thanks, Raquel. See you guys next week.